Today, I would like to thank you, Councilmember Nadeau, Councilmember Gray, Mayor Bowser's administration, and all the people who helped so that FY23 budget includes funding for the repealing of the 6-month DC Alliance certification process, as well as eliminating the need for an in-person requirement. As a registered nurse, I work with many HIV patients who require screening, linkage, and retention in care. Currently, many of the HIV patients that come to La Clínica del Pueblo are members of the DC Alliance and the Aid Drug Assistance Program, ADAP, which provides access to medications. Because many HIV patients tend to have comorbidities, access to specialist care is vital. For a low-income immigrant community, this access is made possible by the DC Alliance. As a health provider, I have firsthand knowledge of the barriers created by the DC Alliance recertification rules every 6 months. The constant stress of the recertification required individuals to collect proof of residence and income, many of whom were already in unstable living situations. Adding to the pressure was the potential of having to take time off work and losing a day of wages. Often, these patients ended up missing the recertification window and as a result could not seek needed medical care promptly. Chronic disease management becomes a challenge in these patients if they have interruptions in care. Because the DC Alliance and ADAP both require recertification every 6 months, a process that profoundly impacts my patients' lives. Having to do these twice a year with 2 programs tend to be stressful and counterproductive in improving their conditions. Eliminating the need to the Alliance recertification will significantly reduce and decrease disruptions in care and improve health outcomes. This is a step towards better medical and treatment adherence. If passed, this proposal would remove a long-standing barrier to healthcare for many of our immigrant patients. I kindly ask the DC Council to approve this funding request from Mayor Bowser's administration, as it represents a key step toward a more fair and equitable public health system in the district. I appreciate the opportunity to testify before the committee. Thank you.
Thank you. Charlotte Hoffman.